Welcome! Today, we are cracking the code on what can be a really tough subject, the cardiovascular system. And we're going to do it using some incredibly clever memory aids. Mnemonics. These things are amazing because they tap into how our brains actually like to learn by making connections. They turn super complex info into something you can remember in a flash. So here's our game plan. We're going to start with the basic map of the heart, its anatomy. Then we'll get into how it all works, its physiology. After that, we'll look at the clues for when things go wrong, the drugs we use to fix them, and finally, we'll zoom way in on the biochemistry and even the little microbes that can cause big trouble. First up, anatomy. You can't really understand how the engine works if you don't know the layout of the parts, right? So let's start by building a solid mental map, beginning with one of the most fundamental components, the heart valves.
Okay, knowing where the 4 heart valves are on the chest is absolutely crucial. But remembering their order from top to bottom can be a pain. Well, it's actually super simple. Just think PAMPed. That's P for pulmonary, A for aortic, M for mitral, and T for tricuspid. It's a really quick way to keep their orientation straight in your head.
So that's the adult heart. But what about way back, before we're even born? Fetal circulation is a whole different ballgame, with some unique parts that change right after birth. Remembering what they become can be tricky, but of course, there's a great little memory trick for that too. Now, this is what I love. The clue is right there in the names. The left umbilical vein becomes the ligamentum teres of the liver. See that L connection? And it gets even easier from there. Ductus venosus becomes ligamentum venosum, and ductus arteriosus becomes ligamentum arteriosum. The words themselves are practically giving you the answer. Okay, so we've got the map down. Now, let's see how this thing actually runs. We're moving from the heart's static structure, its anatomy, to its incredible dynamic function, its physiology. The cardiac cycle is this beautiful, precise, 8-phase sequence. Now that sounds like a lot to memorize in order, doesn't it? But what if I told you all you really need to remember is this one sentence right here? This is your key. And here's how that sentence just perfectly maps out the whole thing. The first letter of each word gives you a phase: atrial systole, isometric contraction, maximal ejection, and so on, all the way to reduced filling. It's a complete roadmap for the rhythm of the heart. So what happens when that perfect rhythm gets all out of whack? Well, that's where antiarrhythmic drugs come in. They're split into 4 main classes based on which ion channels they block. And to keep them all straight, all you have to remember is NKB. Yup, N is for sodium channel blockers. B for beta blockers. K for potassium channel blockers. And C, well, that's for calcium channel blockers. That simple little acronym helps organize a whole field of pharmacology. Pretty neat. All right, we know how it's supposed to work. So now let's put on our detective hats and look at what happens when things go wrong. These pathology clues are all about diagnosing disease quickly and accurately. Rheumatic fever is a really serious condition that can do lasting damage to the heart. The diagnosis hangs on spotting 5 major signs, and luckily for us, they're all packed neatly into a single, easy-to-remember name. And that name is Jones. J is for joints, O is for carditis, and you can just picture the O as the shape of a heart, which is perfect. N is for nodules you can feel under the skin. E is for erythema marginatum, which is a specific rash, and S is for Sydenham's chorea. It's such a simple and powerful tool for diagnosis. Surviving a heart attack is just the first battle. That period right after is filled with serious risks. So what are the major complications you have to watch out for? Well, our next mnemonic has the answer. Just remember what the heart hears. H for heart failure, E for embolism, A for arrhythmias, R for a devastating rupture of the heart wall, and S for shock. Every single one is a life-threatening possibility that this mnemonic helps keep right at the front of your mind. Okay, let's switch gears and talk about treatment. Medications can be miracle workers, but they all come with risks. Remembering the potential side effects of common heart drugs is absolutely vital for keeping patients safe. So ACE inhibitors are a huge deal in cardiovascular medicine. And for one of the most common ones, captopril, we get this fantastic mnemonic that's literally built right into its own name. I mean, look at this. Every single letter in captopril stands for a potential side effect. It's got everything from that classic dry cough that everyone knows about to really serious stuff like angioedema, high potassium, and even renal failure. It's an unbelievably comprehensive memory aid hiding in plain sight. And here's another super handy pharmacy trick. How do you tell the difference between beta blockers that mainly target the heart, the cardioselective ones, and the ones that don't? Just think about the alphabet. As a general rule, the drugs from A to M tend to be cardioselective, while the ones from N to Z are usually non-selective. All right, for our last section, we're grabbing our microscopes and zooming way, way in. We're going to look at the chemical building blocks and the tiny invaders, the good, the bad, and yeah, the buggy, that play such a huge role in heart health. When we talk about cholesterol, it really all comes down to which way it's going. Just think of LDL as lethal. It's the delivery truck that drops off cholesterol in the tissues, where it can build up and cause problems. On the flip side, HDL is healthy. It's the garbage truck that hauls cholesterol away from the tissues and back to the liver. So remember, L is for lethal, H is for healthy. This is a brilliant way to connect specific bacteria to endocarditis, because the type of bug often depends on the type of heart valve. Just remember this little rhyme. Skin bacteria tend to stick to synthetic valves, while strep bacteria stick to standard or native valves. It makes so much sense when you put it that way. So, to wrap all this up, it's pretty clear that these aren't just clever little party tricks, right? They are actual structured frameworks. They help you organize a mountain of information, pull it out of your brain quickly when you're under pressure, and ultimately build a much deeper, more connected understanding of how it all fits together. And honestly, this just scratches the surface. The real magic isn't just memorizing these specific mnemonics. It's learning how to learn this way. So the question I want to leave you with is this. Now that you've got these keys, what other complicated subjects could you unlock with a simple mnemonic of your own? Thanks for tuning in.